Welcome back. Thank you so much for joining us today on Healthwise.
Thank you.
Dr. Olumiwa, what is travel health?
Travel health is an area of medicine that looks at the management and the prevention of health problems, infections, and illnesses that may occur while on the travel. Usually, it's an area of medicine that looks at international travelers when they move from place to place and the health and risk factors that they can get exposed to while they're in another geographical location or a country, which is what is referred to most of the time. So it's an area of medicine that looks at prevention and management of health conditions for international travelers as they move about.
Okay, Mr. Egusa, would you like to give us your own definition?
Let me define how a travel consultant comes into travel
Okay, that's
health.
fine.
Travel consultant is a person trained in the travel industry to advise and provide services for persons seeking to travel.
Okay, so I think that takes me to my next question. What role does a travel consultant play in travel health?
Yeah, the travel consultant advises people seeking to travel on their medical travel arrangements, on the routine vaccinations to take, and the various selective vaccinations to take before their travel.
Oh, okay. So, Dr. Olumiwa, what steps should be taken by a traveler in order to stay healthy on the trip?
A traveler should ensure that he assesses himself in terms of health before traveling and make sure that he prepares adequately for maintaining his health while on the trip. It's good to look at it from three perspectives: what to do before you travel, what you do while you're on the plane or you're on the ship, as we refer to most of the time because we're talking about international travel, and what you do when you get to your destination. Now, coming from what you do before you travel, you need to ask yourself the question: do I have any health condition that I need to see a doctor for before I travel, so that I can make the plans to go my medication or take vaccination or take drugs before I embark on trip. So you have to be sure that you are healthy before you travel. It's good to go and see a doctor and let your doctor know, I'm going to be traveling for a certain number of time. Let's say 2 weeks. I'm going to this region. If you have a pre-existing medical condition, that's the time that you should get your refills for your medications. For example, for an adult, hypertension, anti-diabetic drugs and all that. If you're asthmatic, make sure you get your inhalers and all those things that you need before you travel. Then make sure that you see your travel consultant, like he has said. The required vaccinations, you take them before you go. And have like a little bag where you put things that we can call like first aid items that you can use to treat yourself, mostly over-the-counter drugs, which are legal. You can take them along when you travel. Things like Panadol, little things that you can use when you are outside the country. Then when you're on the plane, you have to take some precautions depending on your health status. For example, for people that are elderly or people that are overweight, because of the risk of deep venous thrombosis, DVT, you should avoid sitting down for a very long period of time on the airplane. So you want to get about most of the time and walk about, make sure that you do some exercise. You're not just sitting to reduce the risk of developing a DVT while on that plane. Then if you suffer any other medical condition, you may let the air attendants know that I have this, so that maybe they will put you in the right position and check on you on time to know that everything is fine. Then when you get to where you're going to, you need to know that you might need to actually access health care wherever you're going to. And that brings us to the issue of health insurance. It's good for travelers to actually have obtained health insurance cover for where they are going to, because we don't plan to fall sick. And if you do fall sick, you should have access to health care.
Because most countries don't actually need health insurance.
Yes. Some will not request for it, but we have for the Schengen countries that will insist they must have it, so you don't have a choice, you have to get that. But even beyond that, you must have plans. What if I fall sick? At least make provision.
So it's important to have health insurance regardless of the country you're going to.
Yeah, it's not mandatory. But even if you don't have the cover, make sure you have some provision for some cash, that in case I need to see the doctor, at least I should have some emergency, fund somewhere, because if you don't have health insurance, it's going to be pretty expensive. So you may want to have just a little amount of money just for emergency in case you may have to do that. So that's important, what you do before you travel on the airplane and when you get
I want Mr. Egusa to talk this as a travel consultant.
Okay, before traveling, you have to look at it. Some people have health problems.
Okay.
So they have to put that in place before they travel. Like some people might be asthmatic. Some people develop the various diseases. So while on board, the major diseases that can be, the major problems that can occur while on board, maybe say respiratory problems.
Okay.
Or you say noise factor. Because while the plane gains height, or if there's turbulence in the plane, it tends to affect sound. So that's why some airlines give earplugs. Earplugs to reduce the noise.
Okay.
And also when you get to your destination, anything can happen. As my colleague has said, you need to have health insurance, medical insurance.
Okay. Thank you very much. Thank you so much. Okay. Now, Dr. Olumiwa, I need you to stress the importance of travel health.
Okay. Travel health is very, very important. Everybody maybe travels for a reason, for a purpose. And nowadays, because of the ease of traveling and because of increasing globalization, it's very easy for somebody in point A to be in point B in no time. Okay. You can be in Nigeria today, in the next 8 hours in the UK. The outcome of this is that nowadays it's so easy for diseases to spread from place to place because people move about so easily nowadays. As we're speaking, there are some outbreaks of some diseases in some countries as we speak. There's an epidemic of some very, very dangerous diseases. So the traveler needs to be aware, what are the risk factors, attached to this location I'm going to. Okay. If I'm going to a destination, I want to be sure, are there some, risk factors there at the moment that I can be exposed to. So you want to make sure that you prevent that, you plan adequately to protect yourself. Okay. Then also, you can also be bringing some of those risk factors too. True. Somebody for example, from a country that's having an epidemic of Ebola can be carrying the virus and be going on board a plane. True. So the risk is also there for the people the destination you are going to. So it becomes very important at this age and time where travel is so easy, it's so fast, that diseases most of the time can easily be spread from one location to another. Okay. Somebody coming from Nigeria can easily just take malaria parasites there if it's currently infected. So it's important for us to know that we need to plan, we need to protect ourselves, and as you do that, you're also reducing the risk for the people on the other side. Then if you're aware of what is happening on the other side, you plan and you protect yourself so that you don't fall ill while you're there. Okay, now, so to Mr. Ewusa, so are you saying that apart from the Schengen countries, which I'm aware that you need to have your health insurance, now countries like America, UK, are you saying if I have my health insurance, I can go there if I'm ill, I can walk to any of the primary health care centers and be attended to?
No, I wouldn't say you can walk into there and be attended to, because first of all, you have to be a citizen for you to actually be attended to with the necessary primary health. But you could also go there on when visiting or visit purposes and get attended to.
With my travel health?
Yes, with your travel health.